What is up, guys? You know what day it is. True motherfucking crime Tuesday. I know a girl's been inconsistent. I know I've been gone. I know my camera's dying and it's always dying. So hopefully I get through this without getting pissed off at myself for never being prepared. Today we got a long one. So I'm probably going to do something a little different today. And I'm going to be doing just like filming at a different angle. Don't mind my ghetto now. And try to just do below the eyes. Just to kind of keep focus off my eyes going to reading my laptop. Because I wrote a bunch of notes down. So it's just, I know the story of lobotomies. There's so many names, so many dates, and I just don't want it to be distracting. The fact that I don't know it on the top of my head. Everything. So that is my goal for you guys and for myself, is to eventually like get really well with these stories where I don't have to read off of anything. I know there's been a few stories in the past where I actually didn't, but this definitely isn't one of them. So yeah, as you can see by the title, we're going to be learning about the story of lobotomy. So yay. Obviously this isn't like a murder, but it's still, well, maybe you don't know that, but I mean, people still died, so I still consider it true crime. I don't know. So let's get into it. Okay guys, so we're gonna go back into time in the 1800s, and let's just go there and learn some history. So, before the lobotomy, there was a Swiss psychiatrist in 1888, Gottlieb Burckhardt, probably pronouncing that wrong. Let's call him Burckhardt. Burckhardt never did surgery, but he thought mental illness was basically caused by the structure of the brain, and that all you had to do was get in there and take out the bad parts and get things in order. Almost like a car. It sounds like he's describing a fucking car. Or illness. So he decides to take 6 patients with mania, dementia, paranoia, and he cuts out chunks of their cerebral cortex, which is it's basically the thin layer that covers the brain. One patient goes into convulsions and dies. One seems better, but later commits suicide. 2 were the same, and 2 got quieter. Okay. His systematic attempt at human psychosurgery performed in the 1880s and 1890s are experimental surgical forays that are largely commended by psychiatrists at the time, and they all mock him till he gives up, basically. Fast forward to the 1930s, Portuguese neurologist Egos Moniz, who has similar beliefs, but he's opposed to removing pieces of the brain. So he leans forward to cutting the frontal lobe neuroconnections. The frontal lobe is the control panel for emotions. It's for, it's our problem solving, our memory, our judgment, sexual desires, shit like that. Basically what makes us us. Like our personality. Moniz thinks that this is where all our problems are, and he thinks that if you take some of the white fibers from the frontal lobe, it can help. So him and a colleague, Almeida Limo, probably not pronouncing any of these right, want to test out his theory, which he calls a lobotomy. So he does this on 20 people who suffer from schizophrenia, anxiety, insomnia, hallucinations, and depression. With the first surgery done on a 63-year-old woman taking small... Sorry, my eyes are like watering up for some reason. So the 63-year-old woman, he's taking small corings of the patient's frontal lobe. So they're going to drill into the brain initially. They say the woman seems better, and that 14 out of 20 of them are reported to be initially cured or improved according to them. Moniz couldn't do these himself since he had gout, which left his hands, unusable, and he told Limo what to do. He's basically standing by and giving him directions. So it's a little trigger warning if anybody gets like squeamish. So they start cutting holes in the skull, inserting a wire loop into the brain, rotating it around to break up the white matter connections. Some people are okay with this because it seems popular at the time and enough to win him a Nobel Prize in 1949. So this becomes kind of like a well-known thing. But he catches heat from the procedures because some people in the medical community are saying he's not looking at the long-term effects. He's not following up with his patients, which obviously is very important. So now we have Walter Jackson Freeman, who becomes known as the father of what he coined the lobotomy. So Freeman was born in 1895 in Philadelphia, Pennsylvania. His grandfather, William Keene, was a well-known surgeon during the Civil War. His father was a very successful doctor, but his dad had hated his job, he hated his patients, and he encouraged his son to not enter the medical field. I can't fucking read. Freeman didn't really give a fuck what his dad said. He still continued to what he wanted to do. So he basically attended Yale in 1912. This guy was really smart. He graduated in 1916, and he was only 21 years old. So he studied neurology. So Freeman eventually relocates to Washington, D.C., and he starts practice at the first neurologist in the city, which is a Fresh Science. He gets a job at St. Elizabeth's, which is one of the largest hospitals for the mentally ill at the time. So 28, he's the hospital's youngest laboratory director in history. To his horror, though, he sees what's going on at St. Elizabeth and he's horrified. It's basically a dumping ground for mentally ill. Families not knowing what to do with their loved ones and leave them there, or people not fitting into society, or people with depression, anxiety, are just at this place with people who have severe mental illness that needs to be treated. But there really wasn't much treatment at the time, so they were basically just housed. At the time, there was just experimental medications, procedures with little success rates like electric shock therapy, I don't know why I paused there, freezing cold baths, restraining people, leaving them naked just so they don't hurt themselves. These hospitals all over are basically warehouses to keep these people out of society. So Dr. Freeman had his heart in the right place and wanted to help these people. He was super cocky though. He didn't think things through. A lot of people that worked with him said he was a show off, even students. There was a story that a dude basically comes to Freeman to help him get a metal ring off his dick. What that guy was, who knows? The guy was having a good time. He wanted to put a metal ring around his dick, right? And get stuck. So Freeman, helps him get it off. And the dude kind of wants it back, for whatever reason. And Freeman was like, no, I'm going to have this as a keepsake. And then he engraves it and wears it on a gold chain. He's wearing this guy's dick ring around his neck. Fucking weird. While working at Georgetown University, the students even flocked to his lectures, saying that he had performances based on autopsies that were described as theatrical, and he wears big hats and carries a chain, and he even wears gold chains outside of his medical clothing. Can you even imagine? No hat is okay to wear, and performing surgery, doing no hat's okay. Maybe those little tiny ones, but can you imagine? I don't even know what. And he's wearing gold chains outside of his lab coat. What are you doing? Freeman idolized Moniz and calls him his dear master. He modifies Moniz procedure and renames it the lobotomy. He loses his license to perform surgery after a patient dies on his operating table. So bad news. So he gets a friend to do a surgery for him. So he enlists James Watts as a research partner and tells Watts what to do during the procedures and just stands over him. And September 14, 1936, at George Washington University, Freeman directed Watts through the very first prefrontal lobotomy in the U.S. on a housewife named Alice Hammett. So Alice, she struggled with depression. She wants to back out of the procedures because during it, they have to shave a large portion of her head. and that's like one of her fears is like losing her hair. And Freeman promises that he'll only do a small area, and they basically put her to sleep against her will and fucking lied to her, and they shaved a large portion of her head. So it's like he wants to help people, but he wants to do it in his own way. You know, when you're a doctor, if your patient's saying don't do this or they're not comfortable with this, like you need to listen to your fucking patients. But he honestly was just doing what he wanted. You know what I mean? And so basically, in under an hour, using an older procedure, she is lobotomized. When she wakes up, she claims to be happy. She doesn't care about her hair. So to them, that was a success. After a week, though, she cannot speak. She can't speak well. She can speak, but not well. She's disoriented and agitated, and Freeman still thinks he did a great job, though. 2 months after the first lobotomy surgery, Freeman and Watts worked over 20 cases, including a bunch of follow-up operations, and by 1942, the duo performed over 200 lobotomy procedures. So they were published results saying that 63 patients have improved, 23 were unchanged, and 14% got worse. 14%, that's a large amount. In 1946, Freeman performed the classic lobotomy. Freeman heard of a doctor in Italy, basically, who operated on patients' brain through their eye sockets. So this is where it gets fucking nasty. Not that the first lobotomy. So Freeman formulates a new procedure called the transorbital lobotomy, aka the ice pick hammering, the ice pick lobotomy. So first, you make the patient unconscious through an electric shock, then inserting a metal pick into the corner of each eye socket, hammering through the bone with a metal mallet, moving it back and forth, severing the connections to the prefrontal cortex and the frontal lobes of the brain, scraping the white matter until it's non-functional, and then you do the same through the other eye. So not only do you do this once, but you do this twice. They hammer a fucking ice pick through your eyeball. When he does the first ice pick lobotomy on a wife, on some girl named Alan something. Okay, I can't pronounce her last name. So Alan's daughter said that her mom had actually changed for the better. That her mom was very suicidal all the time, and that after the whole ice pick shit, her mom had never mentioned like suicide again. And that Freeman gave her mom back. Before this style, he wasn't able to perform a procedure on his own, but this new ice pick method turned into an outpatient procedure, so he could actually get away with doing it with just the help of a nurse nearby. So James Watts, he was like, what the fuck? Like, he was not into this new way. He said it doesn't seem ethical, it doesn't seem safe, and it's reckless, and it's unsterile. They fight over Freeman's idea that all psychiatrists should be able to do this procedure during exams whenever they want. So imagine going to an simple exam, and if a nurse wants to do it, they could fucking do it. Like right then and there, just like an ice pick through your eye. The two-part ways after... Sorry, it sounds like I got a breath. The two of them basically part ways when Waltz walks in on Freeman performing a transorbital procedure without his knowing in the office. Freeman is so oblivious, like doing the procedure, he doesn't even realize, like, obviously it's Watts, but he's just like, hey, can you take my photo? And Watts is just appalled by his recklessness and storms off. Despite this, in the early 1950s, lobotomies had become the all rage. They were just like the thing to do. You know, girls are getting lip injections while people are getting lobotomies. Step your fucking game up. Freeman loves doing these. He loves all the attention he's getting. He has turned his doctor's coat to a muscle t-shirt, and he's now nailing both ice picks in both eyes almost at the exact time. So he's trying to do this quicker. He's almost trying to show off, you know. He wants to freak people out who are watching. He basically has an audience. In just 2 weeks span, he performs 228 lobotomies in West Virginia alone, and doing it on people as little as having bad headaches. It takes less than 10 minutes to complete. So it's super fucking fast. Despite multiple deaths, though, and bad cases, surprisingly, the procedure seems to be helpful, but some are tragic and make people's lives worse. One incident is actually JFK's sister, Rosemary Kennedy. So she basically dealt with physical and mental development issues, and she would have seizures and violent outbursts. When she was 23, her father, Joseph Kennedy, and Les Freeman and Watts, who were a team at the time, and this is how Watts describes how it went to an author later on. He basically said, end quote, "We went through the top of the head. I think Rose was awake and had mild tranquilizer. I made a surgical incision on the brain through the skull. It was near the front. It was on both sides, and we put an instrument inside as Dr. Watts cuts, Dr. Freeman talked to Rosemary and asked her something like reciting the Lord's Prayer or counting backwards, and then says they would basically estimate how far to cut based on how she responded. So if she started to become incoherent, they would know to stop. The procedure is a huge failure, and her brain is diminished to a fucking 2-year-old brain. So it fucked her up. She can't speak, she can't walk, and is incoherent. One of the Kennedy nurses who saw the procedure is so disturbed that she quits working in the medicine field completely. The once happy Kennedy is immediately placed in a psychiatric hospital for several years, separated from her family until 1969. Her mom doesn't even visit her for 20 years. Her dad never does, despite all this. When she's older, when she's 68, her nieces try to, give her a normal life and try to make up for all the fucking years. Her lobotomy didn't even go public till 1987. So Howard Jeweler, another famous case, a normal 12-year-old boy who gets into minor trouble. His mom had just died, so I'm sure this kid's fucking going through it. His dad remarries to a bitch of a stepmom who's horrible. And she says she can't control this normal boy, who's probably, like I said, just grieving. And she takes him to Freeman, saying that he won't bathe, he won't go to bed, he turns the lights on during the day. This kid is just out of hand. We need to give him a lobotomy. What the fuck? So she basically says that he's is a problem child, even though he has a fucking job. He's so young. He does newspaper. He's a newspaper boy. He earns money. He's responsible. But she says that he's disruptive to the family, and she insists that he needs lobotomies and that he needs to meet Freeman. So Freeman says that he's different at times and has a vicious expression on his face, and he diagnosed him as a schizo. So a day after they convince his father to perform the procedure in December 1960, he does, and he tells a story. So he gets the procedure done, right? And later you could hear him talking as an adult. You could hear it on iTunes. It's called My Lobotomy. And he just talks about his life now. He's a bus driver. Just talks about what he does now. He said that he used to wake up feeling like a zombie. And he talks about how he later talked to his dad and asked him how could he allow that to happen. So it's just a lot of heartfelt, sad. It's crazy to hear this guy's experience. And that he said that he believes that his stepmom was actually bummed that he didn't turn into a vegetable after the procedure. She even kicked him out of the house as soon as the post-lobotomy. So she's a fucking bitch. In 1952, a surgeon and psychologist in the French army recognizes a new drug in psychiatry. So this is when Dr. Freeman reigns finally ends. Forenzy is introduced to the public, so it's a drug to treat wide variety of mental disorders that people would normally be left to suffer in an institute for the rest of their life, such as bipolar, mania, schizophrenia. The treatment is forever changed. These barbaric methods and are eventually phased out. It's the first antipsychotic. And then because of this, Dr. Freeman's brain business starts to slow down. Society's exposure to the horror of lobotomies has grown, and the stories become more prolific. He has a photo with all his patients doing the procedures, and there's one in specific where he's doing it with a 12-year-old, and he's so distracted, like when he's like posing for the fucking photo, he ends up killing the patient immediately. In 1967, it's finally over, and his last patient, Helen, dies of a brain hemorrhage 3 days after her lobotomy. He spent his life after basically documenting old patients, giving speeches, and trying to convince people that he was only trying to help. And in 1972, he died of cancer. So this guy had performed around 2,500 lobotomies across 23 states. There's even old government records that were found that turns out lobotomies were performed on veterans who returned from the war. His own son has said, you can never, this is end quote, you can never talk about a successful lobotomy. You might as well talk about a successful automobile accident. And that is the story of Dr. Freeman and the history of lobotomies. So glad I didn't live back then, because like I don't know, the fact that they like did this stuff to people who had, like they said, like headaches, depression. Like, do you know how many people nowadays have depression, have anxiety, which isn't normal. Like, it really isn't, the amount of people who are feeling this type of way. But man, the Dr. Freeman would have went to town on us. Fuck. So that is the history. Hope I did okay. Thank you guys for staying tuned and listening to the story. I hope you learned something. Take care, guys. Bye.